All right, today is our second visit with Carley here. Did you see any changes with the first visit?
Yeah, I could feel more movement, especially in my neck. That's where I could feel the most at.
Okay, excellent. And what we found at first was the left L4 with the left leg weakness. We had the left foot not turning in, so it was telling us the left hip. And then also a couple of muscles in the pelvis. The head wasn't turning good to the right, and a couple of areas in the mid-back. So we're going to recheck all that again and let the body show us what to do. The body's very dynamic, so it's always changing, and so we have to check it every time to check to see if anything changed. Push up with the arm, good and strong, and over here, push up with the arm, good and strong. So no problems with the nerves in the lower neck. Go ahead and lay on your back. And relax your feet. That's good. So I'm going to turn the foot in here. This one goes pretty good. And turn the foot in here. See, now this one is actually turning in pretty good today. Before it was moving about right here. Now it's got that range. So your body actually held that adjustment. Okay. Raise this leg up, hold the leg up, and push up against my hand. So today we actually have strength in the leg. This was weak last time. Push up here. And one more time, push up. The mark of a good muscle is 3 times strong. And so we have 3 times strong. Push up here. And that was good. That was good with before. So what that's telling us is the L4 nerve is actually connected. Now the muscles are stronger than what it was, and now everything can start relaxing. So far 2 for 2. So now we're going to check the hip flexor. Bend your knee and bring your knee towards your right shoulder and hold it tight. 1, 2, 3. Come back here. Hold that up, and with your leg, push to the right shoulder. Okay, we do have a little weakness here. The weakness here is not weak, which I can test it to show you. Hold right there. Push to the right shoulder. See how strong it is? It's only strong after you strain it, which tells us that there's a trigger point in that muscle. So if you're sitting and you go to stand up, the muscle stays tight, it pulls the back. So we're going to use a little manual technique like we did last time. Sometimes the muscles are actually so tight they're actually shortened. So it does take a little while for us to finally get some improvements on this. Bend your knee. But again, if we don't work on this, the first time you sit, it could pull everything back out. So, and basically what I'm doing is I'm percussing the trigger point of the psoas muscle. So when you stand up, the muscle's going to be lengthened back up to where you can straighten up easier. But with one visit, we actually have got the L4 nerve connected, the leg's strong, the foot's turning in. So we're actually starting to see some mechanical changes pretty quickly. In fact, that's actually showing me that the spine is stable now, and now we can actually give you a routine of stretches to start going. Okay. Take a breath in, hold it, and let it out. Nice and easy. Put it right back down. We use a technique called applied kinesiology, which actually uses muscle testing to tell us what's going on with the body. Bring your knee towards your right shoulder, hold it tight. 1, 2, 3. Come back over here, hold that up, and then push to the right shoulder. And now we have strength. That's just telling us that it's normalized again. I'm going to give you just a little stretch here. Good. And we're going to check a different muscle called the QL muscle. Both legs together, push out to the left. That is good. And I'm going to stretch it across. 1, 2, 3. And push out to the left again. And see it weakens. So now the body is giving me more to do. Today we're actually going to work on the QL. The QL is on the side here. Okay. Now we can always go back and check the neck. Relax your neck. So I'm going to turn it this way. See, it turns a little better. It stops about right there. Compared to this side, which turns even better. So it's still a little bit restricted. I can actually do a little muscle test to find out exactly where it's out of place and push across. So the little weakness tells us that it's the C1. So we're going to make an adjustment C1. I'm going to bring it here. Put it back in place. I'm going to turn you this way and see how much better it turns. That's what we're looking for. The other one's turning good, so go ahead and lay on your stomach. Chiropractic treatment is pretty simple if you just focus on the mechanics. We're not focusing on the pain, but when the mechanics are right, the pain also goes away. Drop your arms down. There you go. So we know we have the QL muscle, which is a muscle on the side here we're going to work on. But we're also going to check the piriformis muscle. So push in towards me. That's good. And I'm going to give you a little stretch out to the side. 1, 2, 3. Push in towards me again. And that is actually good. Now I'm going to go to the spine, the SI joint, the pelvis. Bend the knee and push up against my hand. We still have a little weakness there. I'm going to go on the right side just to check. Bend the knee, push up against my hand, and it's good. So what it's showing me is the left side pelvis is rotated back. It's the same adjustment we did last time. Today we may actually get a little more movement. A little tight right there, a little tight right here. So a couple of areas in the mid-back, which we had last time also. So go ahead and lay on your side and face the window. Okay. So this is giving me another piece to the puzzle. Working on the QL muscle. The reason we call it QL is because it's quadratus lumborum. Kind of a big name. And all I'm doing is doing a little fascia work. The fascia, what I'm doing is I'm just stripping the muscle out with the percussor. Kind of going back and forth. That muscle goes around the back, actually. A little tender? Ticklish?
Yeah.
It's kind of a goosey point anyway. And I'm going to kind of get in there. And we'll be able to test it to see if it actually worked. All the treatments are retested to make sure it worked. Okay, and you can stay just like that. Bend this knee up. So we're going to do a side posture. The side posture is a top of the table there. Side posture is the best way to adjust the lower back and the pelvis because you're on your side. It's the least amount of pressure on the spine. When we bend the leg up, it flattens the sacrum out, which actually opens the holes that the nerves come through. So when we make the adjustment, it actually resets the nerve system. Okay. Grab your arm and elbow. Turn your head, look up at the ceiling. So I'm going to roll you a little bit to me. There you go. And the adjustment's going to be right here at the SI joint. So I'm going to roll you a little bit to me and back a little bit. There you go. Felt a little release. Okay. Now go ahead and lay on your back. And I'm going to stretch you here, like we just did. See how much better it stretches? That's a good sign. And then both legs push out to the left. And now it's definitely strong. If for some reason that was to be weak, I will go back and redo it because it means we didn't get it.
Okay.
Let's go ahead and sit you up. Good. Let me pull this in a little bit. And just face that way. And raise you up a little bit. Now we're trying to get the upper back, mid back, arm here and here. Okay. And then go ahead and come back. Breath in and out. Good. And one more time. Breath in and out. Good. Good. So got those two moving. Give you a little stretch back this way. All right, and then sit and face this way. So today we're going to give you a routine of stretches because the number one cause of pain is muscle tension. And so if you're working on muscle tension every day, you're going to get rid of the pain and it's not going to come back. If all we do is adjust you, you're always going to need the adjustments. You're always going to have these little flare-ups, little episodes. So we want to teach you how to take care of it so you don't have those episodes and we actually get it corrected. So the routine is going to stretch the front and back of the legs, front and back of the pelvis, and a little bit of core strength. The recommendation is to do the stretches when you start your day and your day.
Okay.
Okay? Very good. I'll clip this off.